Hello, I'm Tyler Brock, and I'm the Deputy Director here at Siouxland District Health Department. In today's video, I'll be discussing the topic of testing for COVID-19. Here in Siouxland, we are just getting into our Omicron surge that other parts of the country have been experiencing. And just like previous case increases, our demand for COVID testing has skyrocketed recently. For example, last week, almost 5,000 tests were reported for Woodbury County alone. And if that's happening here, imagine how much testing is being done across Iowa and the rest of the country. It's really important that we maximize the benefits of COVID testing and to do what we can to minimize the pressure on supplies and test shortages so that those who need testing the most will have it. As we close in on 2 years of COVID activity, it's clear that stopping the transmission of COVID is extremely difficult. It's also clear that our top priority needs to be preventing infections from becoming serious. And while vaccines and early treatment options are important in preventing serious infections, testing also plays a critical role. Early diagnosis via COVID testing is especially important for symptomatic people that are at increased risk for serious infection. This specifically includes those over 65 years old, women that are pregnant, and people with certain medical conditions such as cancer, diabetes, chronic lung diseases, heart conditions, and those with weakened immune systems. People in these categories should be tested as soon as symptoms begin to allow for early medical care. Additionally, if high-risk people have close contact with someone who's got COVID, but they are not having symptoms, they should get tested, but should wait at least 3 days after the exposure to get tested. Actually, testing 5 to 7 days after the exposure would make testing more accurate and be a better use of the tests. But if you're not at high risk for serious COVID, testing for COVID might be less critical. You may consider testing if you have symptoms, but if you're sick, you should stay home and try to minimize your contact with others regardless of whether or not you have a positive COVID test. If you're not at high risk for serious COVID, you may also consider getting tested after close contact with someone that has COVID, but you should wait until 5 to 7 days after your exposure before being tested. Testing of asymptomatic individuals that are not high risk or do not have a close known exposure to COVID is usually not necessary. Now I'm going to take a minute to talk to our business owners and supervisors and managers. We're getting a lot of local workers coming into our clinics because they are being required to be retested after a positive test prior to them coming back to work, or they are being required to get a doctor's test after testing positive with an at-home test. This type of testing is unnecessary and is placing a large strain on our medical community and local testing supplies. So I'd like to encourage our businesses to simply use the time and symptom method for returning to work and not require a testing strategy that is not recommended. Getting tested for COVID-19 after infection to see if that infection is gone is not recommended. COVID tests, especially PCR tests, can remain positive for several weeks after infection, and a positive test after infection does not mean that you are still infectious to other people. This occurs because sensitive tests can pick up fragments of the genetic material of these viruses well after that virus is no longer able to spread it to others. We also don't need to be testing to verify previous tests. If you have a test that's positive, whether it's a PCR or a home test, just begin your isolation. There's really no need to confirm this. Here at Siouxland District Health Department, we understand that it's not easy to be running a business during this pandemic. You are all in a very tough position and we'll do what we can to help you. But there are recommendations in place to help you navigate COVID that don't require extra testing and don't cause undue pressure on the community's critical resources. We also understand that there are many testing requirements that the public faces today in a variety of settings, such as travel and attending events that place added strain on testing supplies. We want to help you with this, but we can't have people stockpiling test kits, and we can't have folks just getting tested over and over again unnecessarily. Rapid testing, where results are available in minutes, are going to be in very short supply for the near future. We do have test kits available at Siouxland District Health Department in a variety of locations throughout the county. This is not a rapid test, but you collect a saliva sample yourself and then you submit it to our state laboratory. The goal of this program is to have results in 24 hours. However, with such a high demand on the lab right now, we can't promise that quick of a turnaround time. And these tests are only for Iowa residents. Our friends from South Dakota and Nebraska, your state should have similar programs, and you really should check with those states to see how that program works. Additionally, these tests cannot be used to satisfy workplace requirements. So while distinguishing between COVID and other infections that are circulating via testing may have some benefit to preventing the spread of these illnesses, our first priority for testing is to prevent serious infections. People that need testing the most are those that are sick, and especially those that are in the high risk for serious infections. Too much of our local resources are being used not on people who are sick or with exposures to COVID, but for testing that's being done simply to provide documentation. As the demand for testing has dramatically increased lately, we have to be able to make sure that our highest risk people have testing when they need it. We need to maximize the benefits of our testing to preserve these medical resources and ensure that testing supplies are available when people really need them. Thank you very much. Have a good day.